Hello, everyone. I am Steve Blanchard, and I'm a member of the public relations team here at Moffitt Cancer Center. Thank you so much for joining us for a very special Ask the Experts Facebook Live on Neurology and Oncology Awareness Month. We have our neurological surgeon here, Dr. Arnold Etame, as well as his patient, Abby Baker, here to talk about several things, but mostly about a procedure called an awake craniotomy. Dr. Etame, Abby, thank you both so much for being here today. I'm really excited to learn about your journey, Abby, and of course, the surgeries that, of course, Dr. Etame assisted with. But before we get underway, I want to remind all of our folks who are tuning in on Facebook to feel free to ask a question for either Abby or for Dr. Etame. You can do that in the comments section below the video. We will do our best to get as many of those included as possible today and get those questions answered for you. But also, please remember that we cannot offer medical advice or any diagnoses over Facebook, and that everything you post is public. So make sure you think of that as well and your own privacy before you share those questions. So let's jump in. I'm so excited to have you both here. We're going to start with just a kind of a general of what is an awake craniotomy. And Dr. Etame, I want to ask that to you. I've heard that term a lot, and I think I know what it is, but in layman's term, what is that procedure?
Yeah, sure. Thank you very much, Steve, for that kind introduction. And thanks, Abby, for sharing your cancer journey. That would clearly inspire a lot of patients, people who go through this journey. So the awake craniotomy basically refers to a procedure where during the removal of the brain tumor, the patient is awake so that the patient can be tested as the tumor is removed. It's usually, for the most part, tumors that are close to areas of language, areas of movement, because the brain has no sensation. So when you remove brain tissue, patients do not really have any perception of pain. So if we've blocked all the nerves on the scalp, which generally generate pain, patients can be comfortable during this operation, and they get some sedation from our anesthesia colleagues. But the main goal is to be able to test to see if the area that we're removing has very important function, which if it does, you might consider not removing that area. It also allows us to know if during removal of the tumor, the patient is getting into trouble. So at that point, we know where the stopping point is.
How long does a procedure like this typically last?
It varies really on the location and the complexity of the tumor itself. I would say probably about 4 hours. Some take even longer.
Okay.
Yes, and since the surgery, unlike operation under general anesthesia, we are relying a lot on the effort of the patient. So there are times when we have to take breaks to make sure that the patient is okay. So that adds some time to the operation as well.
Right, and this is a situation where the patient is literally your partner in surgery. They're awake, they're conscious of what's going on. And Abby, I know that you've experienced this firsthand. And in 2019, I believe you said was the last time that you had this surgery. Before we dive into that, I was wondering if you could tell me a little bit about your diagnosis and how you wound up as a Moffitt Cancer Center patient.
Well, when I first started feeling the different, what I would say would be considered auras, so they were like, I was having deja vu moments, and that started at the end of 2015. Then it was about the beginning of 2016 when it was pretty consistent. Every time I would start to exercise, I was getting these auras. I kept going to doctors to try to figure out if I was having brain cancer or other things, because I had definitely Googled it and it did come up immediately with brain cancer. But they were saying that given the fact that I had children, that it was just stress and that everything was fine. But then it started picking up the pace, and I was finally then approved to see a neuro, and that wasn't until January/February of 2017. And immediately I got the MRI, and it showed that I had 5.7 centimeters in the left temporal in the brain.
And 5.7 it refers to the size of the tumor. Is that what you mean?
Yes.
Okay. Dr. Etame, is as far as on a scale, how large of a tumor is that? Is that sizable? Is that where would that fall?
It's quite sizable, especially within the temporal lobe. It's quite sizable. Yeah.
So obviously, after speaking with your neuro, you found your way to Moffitt Cancer Center. And fast forwarding a little bit, I know there were lots of consultations and chats, but the idea of an awake craniotomy was brought up. Abby, when those terms were brought to you and that surgery was explained to you, what was your reaction like, knowing that this would be something you would undergo?
I knew that it was going to be awake-ish, but that you probably wouldn't truly be alert with everything. I will say that the first surgery, I don't recall it. I remember it being about 7 hours, and it was intense. The aftermath was definitely different and awful. But
So the healing part, it sounds like, was the more challenging than the actual surgery itself.
Exactly. But then the second surgery, that one I was definitely pretty alert. I mean, to this day, I can still recall and I think Dr. Etame had even said that it was more awake. I could see more
You're
with
a
that.
little bit more alert.
Mm-hmm.
Dr. Etame, following up on what Abby just said, there were 2 times that she underwent this procedure, once in 2017 and again in 2019. Is that typical in a situation like this where multiple awake craniotomies need to happen, or is this kind of an exception to that rule?
Actually, it's quite common. So what Abby has is she has an astrocytoma and anaplastic, so a high-grade astrocytoma. These are primary brain tumors that are quite diffuse. So even though you see what looks like a round mass of tumor, there are tumor cells that are hiding in the normal brain surrounding that area. So when Abby had the first resection of tumor, at that time, she had a complete resection based on looking at the MRI, and the tumor was in the left temporal lobe. The reason why she was awake was on spatial functional MRI, she had language associated with that tumor. And even after surgery, she had some slight challenges with language. So after resection of that tumor, what typically happens is the quiet tumor cells in the surrounding brain, they can become activated. And when they become activated, that brain tissue now grows into new tumor. So that was the scenario. So it's quite common. And since the first surgery, there were some language challenges. The second surgery, she needed to be awake. But what's remarkable about these tumors is that they change the way information travels through the white matter in the brain. So the explanation is that the first time you might have language challenges, but the second time when you go to remove the tumor, language function has already moved to other areas. And that's why her second surgery was, her recovery was quite good. And even though she, on an MRI, a lot of her temporal lobe is missing on the left side, which would be the language side, she's still able to communicate very well. And so it's quite remarkable how the brain functions. Yeah.
It is, and it's remarkable, Abby, that you've done so well, and you've been able to do this recovery. We have a question that came in from Jada, who was asking about when your surgery was performed, and I know the first one was in 2015, and the other one was in 2017, and the second one was 2019. But she asked if you could talk a little bit more about that recovery, and specifically about regaining your language capabilities. What was that like for you? Recovery-wise,
the second time is when I really got got even deeper with where I am spiritually. And for me, my passion is truly through meditation and my yoga, just serenity and going to church, just my really passionate calmness, because I truly learned that being at peace with everything, that's just the most strongest from inside and out. I mean, it's mind, body, and soul. And that's truly the number one for me.
And that's amazing to be able to remain calm when you're facing something like this and a diagnosis like this. As far as regaining your speech, was there some therapy involved as well with that?
After the first surgery, that was definitely, I had to go to some speech issues and getting assistance there. But then after that, I realized that really it's kind of in our own hands. Given the fact that like now the whole left temporal lobe is gone out of my brain, I cannot, no matter how much I practice with somebody else, it could then, as soon as I stop talking about that same, it could just be a word and I could be talking about that word. You can give it then a week and I'm not discussing that word, and then that word is gone. So it doesn't matter how many people I meet and have a consistent topic there. It's just not as helpful. It's just, again, with that, it's just working on your own mind at home, just a natural procedure through that.
Right. It's almost like not only did you have to kind of relearn how to form those words, you had to reprogram your data bank almost to kind of remember those words. Speaking of speech and communication, Dr. Etame, switching back to you, you talked a little bit about how during these procedures you're communicating with the patient and making sure that they're okay and that you know where their stress levels lie. What are those conversations like? Do you just kind of ask general questions about their lives to make sure things are okay, or is it more specific? What does that look like in the OR?
Yeah, so generally for awake surgeries, you can, depending on where tumors are located, people can be given tasks to count, name things. In some situations, describe objects. If you are working more close to a movement-related area, you can do basic language testing, but you're more focused on the movement task. So there are times when you're close to the midline of the brain where the movement control would be for the legs, the lower extremities. Your testing is going to focus on that. And then if you so it's really location specific. And then there are times also where you're not really within a movement area, but you're close to a movement area. And so your testing threshold is much different because you know that your probability of compromising function is quite lower in that particular scenario. And one last thing, I said that we do the awakes when tumors involve kind of functional areas. But there are times when we might do it also if somebody has very poor pulmonary or lung function, So some of our cancer patients have emphysema, they've had a lung removed, and you just don't want to put them through general anesthesia with an endotracheal tube. So we do those surgeries awake, or people have very bad cardiac disease, so the stress of anesthesia to their heart is not as profound as it is when you do the surgery when they are awake.
Again, it goes back to that personalized medicine. You have to do what's right for the patient on each individual case. And if you're just tuning in on Facebook, everyone, please feel free to continue to drop those questions in the comments below, whether if they're for Dr. Etame or for Abby. I'm happy to relay those on to them. We appreciate you tuning in and asking those questions. This is a really unique opportunity. And one question that I have, following up on what you were just saying, Dr. Etame, we're talking a lot about surgery, but is there a chemotherapy element to this as well? Is there kind of a follow-up that happens after the surgery or leading up to?
Yeah, absolutely. So it depends on the tumor pathology, but if we stick with the primary brain tumors, the gliomas, which are the most aggressive and challenging, like what Abby had. The treatment is typically surgery, which is maximum but safe removal of the tumor. And safe is very important because there's data that suggests that if you do these surgeries and patients are paralyzed or they get significant deficit, their survival is significantly diminished. So you do surgery and then you do chemotherapy, which is usually a pill called temozolomide that you take by mouth. It's usually well tolerated by patients. They don't get as sick. And Abby can speak to her experience, like so they don't get as sick as somebody who has like IV chemotherapy. And then there's radiation. The chemo and the radiation go together. And then after that period of combined chemo and radiation, patients then go on to get several cycles of the chemo, anywhere from 6 months, for the most part, to some patients that might go up to a year. And then we get MRIs frequently. And anytime that the disease comes back, you always want to entertain the idea, can surgery be done safely? Because if you remove that resistant population of tumor cells, you allow the next set of treatments to be much more effective than having the patient go ahead with treatment when they have tumor that's already resistant.
And one of our viewers, Marina, has a question that is exactly what I was going to ask next. And this is for you, Abby. How often do you need to have MRIs as follow-ups? And what is your medical journey like now? How often do you have to visit with Dr. Etame or with your general practitioner?
I would say, honestly, within the last year is when things really calmed down after these 6 years. I have now moved it to more 5/6 every 5/6 months when I get the MRIs. Before I was getting pretty consistency between every 3 and 4, but again, I'm very much listening to my heart, and just like when I was diagnosed again, I knew it in my heart that it had that I could tell I had cancer. I could tell that there was a seizure. I knew that there were other issues happening. Same with round 2. This one, I can feel my heart and soul, and I know that I'm at peace for now, for years. But so yes, I go every, in fact, I think I go in 2 more weeks. So I will be at getting my little update there.
And that's amazing that you're doing so well, and congratulations to you on that. That's absolutely amazing. But of course, it's not just the doctor's visits. We talked about it's the meditation, it's the support system, it's your spirituality. One of our viewers on Facebook is asking this. They say that they have some short-term memory loss, and they're curious at what you do to help your brain recover. Are there certain techniques that you do? I don't even know what those would look like, flashcards or reading, anything like that that helps with that kind of thing for you, Abby?
Well, see, it's always interesting. Again, you listen to yourself, because after with my radiation, they had told me that 100% I was going to lose my memory. And in a very strange way, my memory is better now than I have had it ever in my life. I really think that has a lot to do with your staying calm, everything with whatever you may enjoy the most. If you like to cook, if you like to go for exercises, if you like to, again, meditate, whatever your favorite things are, I think that's what has a lot to do with your mind. It calms things down in there. And then memories sort of absorb in a healthier way. I truly, truly believe that. That was for me.
And that's amazing that your memory is better now than it ever has been. That's amazing. Dr. Etame, this next question from Meredith is coming in, and it's asking about terminology. She's asking, what does it mean when the word hernia or herniated is regarding a brain? Could you define those terms for us?
Yes. So brain herniation is something that we use when you see it more, say, in a trauma situation, but also you can have it with tumors. So just to put things in perspective, your brain is enclosed in the skull, and the only opening is at the bottom where the skull connects, with your neck, right? Your spine. As you can imagine, when there's pressure inside the brain, the only way for things to go is to push things down, right, towards the opening at the bottom. Unfortunately, the brain stem is what is going to be crushed. So like in a trauma situation where you have a car accident, there's a big hematoma in the brain, it's going to push on your upper brain, which will push on the brain stem. And as the brainstem gets pushed down, that's what's called a herniation. And there are various sites in the brain that this pressure phenomenon starts to occur. Clearly, if you get herniation down in the brainstem, that leads to brain death. Brain tumors can cause herniation if they're substantially large, or if they hemorrhage at a time when a patient is asleep at night and they don't get up in time to get the necessary help from an ER or something. Patients can experience a herniation, but you see it more in the context of trauma because that's something that happens, rapidly, say with a hematoma or with brain swelling.
And thank you for answering that. That was a great way to explain that the definition of herniated. In a situation such as Abby's, and could be for both of you to answer, do we know what causes this type of situation? Is it genetics? Is it environmental? Or do we just not know what causes a tumor like this? And Dr. Etame, I'll ask you that question first.
Yeah, sure. I think if we look at genetic syndromes that predispose to brain tumors, it's a very, very small population. I'll say probably less than 30%, very, very small number. The overwhelming majority of gliomas that we see are what we call sporadic. So they just occur, and clearly environmental factors, can come into play. Just like if we look at other cancers like colon cancers, lung cancer, and so on and so forth, those have a predisposition to environmental exposure, like things that we eat or smoking and so on and so forth. I think these same chemicals that are cancer causing, if they can cross into the blood-brain barrier, they can start to transform cells inside the brain and generate these tumors. But there hasn't been a very clear-cut environmental trigger like it has been with lung cancer that we now know. In a subset of lung cancer, smoking is quite a big risk factor.
And to follow up on that, Abby, and to kind of reframe my question for you, had you had any experience with cancer diagnosis before, either personally or in your family, or was this your first time experiencing cancer so up close and personally?
That was definitely firsthand. I had never known anybody. My stepfather, who had just passed away, he had just gotten kidney cancer at the end of 2015. And so that was sort of my first little journey there. Otherwise, I had nothing. And I know, and I know too that I think that the importance now, though, like I said, I have no idea what it was. I know Dr. Tommy and I had talked about it before. He even said, I mean, I was always active. I was just nothing could have kind of come across my path. But I will say, though, that after a diagnosis with something like that, especially my round 2, even though I had changed everything that I ate, that is immense. I mean, that's so critical. And I know for me, and when I say me, I can definitely say for other people, food is so important once you're diagnosed. I mean, night and day, that's like my biggest journey right now is I love helping other people. I do so many things. Like that's my life is I love helping, but food is a massive helping for anything.
Exactly. Eating healthy and eating the right things. And, everybody loves junk food. Avoiding it
Yeah.
can be really hard. Dr. Etame, back to you. Can you expand on that a little bit? The importance of after going through something like Abby's been through, of having a healthy lifestyle and eating correctly. Well, what does that do for the body? Does it help prevent the cancer from coming back? Does it just maintain where you are? What are the thoughts on that? I'm sure it's ongoing research.
Yeah, I think obviously our foods, as I said, there are, if we look at certain cancers, right? If we look at colon cancer, for instance, if we like people eat foods that are high in, like meat or saturated fats, so certain foods do carry a predisposition, a risk factor, for cancers. Now, the question as to brain cancer, one of the things that people have looked at has been the role of like sugars, on brain cancer, and so there's some thought that if people did, ketogenics and things like that, it might slow down the growth of some of these tumors. But to precisely your question, I think being healthy and eating, the right things, they boost your immune system, they slow down inflammation in the body. And we know that inflammation is a big basis, for cancer as well. So clearly healthy living. And one of the things that was very admirable about Abby is that, this was a life transforming event for her. And she's been able to use the combination of her spirituality and holistic approach to really cope with this cancer. Because as she said, you get MRIs at regular intervals, and it's really an emotional roller coaster anticipating what the next MRI would show, and especially for her that she had within a span of 2 years, she needed a second operation. I think it's much more calming and reassuring for her that, she's gone now since 2019 and her scans have been otherwise.
Waiting for that news, I know is insanely stressful. And of course, we want to hope and pray that it continues to be positive news for all of our cancer patients here. One question that Janet has on Facebook is asking about how to differentiate between a malignant or a benign tumor. Is that just through pathology? And how do we determine that, Dr. Etame?
Sure, it's through pathology. So there are unique features that the pathologist can look under the microscope, the shape of the cells, the nucleus, how fast the nucleus is dividing. Those kinds of things can give an idea about how aggressive the tumor is. So it's mainly what the pathologist sees. Now, for brain tumors, though, there has been a significant advance with genetics and what we call molecular studies. Molecular studies look at certain proteins that tumors produce that can allow us to differentiate one tumor from the other. And within classes of tumors, those proteins can let us differentiate if the tumor is a higher grade or a lower grade. So currently, what the pathology sees under the microscope, it's very important and informative, but what we use now definitively is the molecular analysis, the molecular pathology. So every time we take out the tumor is sent for certain, analysis of certain genes, mutations like abnormalities in those genes, looking at their expression, and then it allows us to tell what kind of grade the tumor is. And some of those genes also have a prognostic, they have a prognostic value. So they can tell us who is more likely to progress very quickly with this kind of cancer and who's less likely to progress,
Right. And I know there's a large team of doctors and researchers who take a look at all that information and continuously to study. If you are just tuning in, remember we are still accepting questions for both Dr. Etame and Abby about awake craniotomies. So please feel free to continue putting those into the chat. I see there's a few more I still need to get to. But before I get to my next one, Abby, I wanted to ask you a question. Your last surgery was in 2019, and you seem to be doing extremely well. How have you talked about adjusting your eating habits, but are there other things that you do differently now that maybe you didn't do before, as far as like driving, for example, or speech patterns, things like that? Are there things that you do from your day-to-day life that you've noticed are a little bit different than, say, pre-2019 or even pre-2017?
Changed my entire life.
Sure.
There's a book called Radical Remissions, and that one I've probably read or slash audio, oh gosh, 6-7 times. And that helped me because it's changed everything. I have, since 2017, it's where I sort of really began with not only food, but again, the meditation, because that calms the brain, which also calms me with my kids, because I'm just always on the go. I also make it a point of doing everything day by day. I don't focus way out in the future, because that's a stress impact. And I think it's really important not to do things like that. I was also paralegal, and that I had to really let go of, because for me, being at home and taking care of the kids and sort of handling things like that, because stress can bring the seizures. And for me, that's what it definitely did. 2017, 18, 19, it was too much. And that was kind of triggering so many other issues. Even when I have too much drama with other people around, I know to take a step back, because I can't handle that type of things. Anything to keep it as calm and neutral as possible. That's why then again, focusing on foods, focusing on my church, with volunteering and helping other people in those ways. And if I do get drama, like, of course, because I'm a mother and I take care of my kids all the time, it's not that same fear, because I don't want that. But again, too, with the fearness, that's something that I was able to erase with this second surgery, because I know it's truly all in God's hands. And that's a huge passion for me, knowing that I will be ready if anything happens, which I know it won't, but I just know that it's important for other people to focus on your life, focus on your confidence, focus on your strength.
And I love how you have kind of taken this experience and kind of geared towards helping others, volunteerism, like you said. Just for those who are watching, what is the name of that book again that you read 6 or 7 times or listened to on audio?
Radical Remission. There's a Radical Remission, and then it also has another one that has Hope, and it's referred by the same writer. Her name, I can't think of it, but it's awesome.
Get on Google and search for Radical Remission, and I'm sure you'll be able to pull it up. That's amazing that you're able to take that to help yourself and then take what you've learned in order to help others. Dr. Etame, shifting back to you, this is more of a technical question. Christina has asked, what is the difference between a craniotomy and a craniectomy? I think I know the answer to that, but you are the professional.
Okay. So when craniotomy means that you are opening the skull, you go in, but when you're done, you put that window of bone that you took out back in place. So we secure the bone with titanium plates and screws onto the regular skull. A craniectomy is you open the skull and you leave the bone out. Now, the question is, why would you leave the bone out? There are times when patients might have tumors that are on the skin on top of the skull that has invaded the skull. So it's through the bone. So when you're removing such a tumor, you have to remove the bone as well because the bone has tumor. The same might apply also for tumors that are inside the brain that invade the bone. The other reason why you leave the bone off is, let's say somebody had a brain tumor that they knew nothing about, and then they somehow collapsed, went to the emergency room. There was so much swelling in the brain. You took them to surgery, you opened the skull, you removed as much tumor as possible, but the brain was still swelling. So you leave part of the skull out because, again, if you put that skull back in place, somebody asked a question about herniation earlier. That pressure is just going to go down towards the brainstem and cause problems. And there are times when people have traumas like car accidents, massive hemorrhage, so much swelling in the brain. You can't really put the skull back in. So you take the skull out, you leave it out. So anytime it's out, it's a craniectomy. And then a craniotomy is like you take it out, you put the bone back in. Yeah.
And again, I had a vague idea of the difference, so thank you for explaining that for us. Abby, we had a question come in for you, and then we'll start wrapping up our conversation. So there's still time to add a couple more questions if anybody would like to ask Dr. Etame or Abby anything specific. But Abby, back to brain health techniques. You talked a lot about meditation, you've talked about volunteerism, you've talked about calming yourself. This is an interesting question, asking if you do things like puzzles or brain games or anything like that as part of your recovery, or is that just not something that you have utilized?
Honestly, I think the speech made that trickier for me, because when I try to handle things like that, just like for me reading, it's a lot, vision-wise as well, from the first surgery. And when I'm reading, it just takes me longer. So I guess for me, then I have different brain working. Like, again, for cooking, before I was never a cook, not even close. And now I do massively cooking. And with that, I try to do brain work there. I know I don't keep the brain empty. I then get in a different thought processes. And so I work with my brain while cooking. That works for me.
I love that. I'm sure your family loves that too. They get to benefit from that cooking. Like I said, we're going to start wrapping some things up here. Abby, I wanted to ask you one more question. When people are diagnosed with cancer, they hear the word cancer. It comes with a fair amount of panic, concern, stress, all of that. And especially when it comes to brain cancer, every time you Google anything, the joke is always, oh, well, it's probably brain cancer. And then they move on and laugh it off. In your case, that was the situation. What was that like for you when you first heard those words in that initial diagnosis? How did you handle that? And any advice for somebody who may be going through that?
That was the darkest I've ever been in my entire life. My heart was broken, destroyed. I just went, my fear was immense. I wasn't sure if I was going to live. It was just when I was first diagnosed, I didn't know how to go about it. But then when I went to church, it just slowly lifted me back up, and it truly brought my confidence back. Just knowing that everything is out of my hands, yet at the same time, it's all in, for me, God's hands. It could be in other spiritual ways that other people can have confidence with. You could have family members, could have animals, anything that just mentally helps with you. That's what brings things calmer and lifting you up. But then once you're able to calm and get into those, then you learn a lot more and kind of get on the excitement of, this is what I'm going to do to get through it, and just focus then on how you can win, because you will, and you will be fine. And what I love doing too is I love volunteering. Like, if anybody needs anything, I am here. I would do anything for anybody. And you can call me, email me, anything. I mean it, bottom of my heart. I can help you understand. I really can.
And that's an amazing gift from all of this, and truly inspirational. So kudos and congrats to you for navigating that. I don't think many people could. One more question from Facebook, and then I promise we will actually wrap up. Dr. Etame, this is for you. This is from somebody who is a medulloblastoma brain cancer grade 4 survivor, and asks, since the brain tumor was by my brain stem, is my brain more altered than the next person? That's all I have. So I don't know how to answer that kind of question. Is where the brain tumor located in your brain, does that alter the brain differently, I guess, in different locations?
Oh, yeah, absolutely. And with medulloblastomas, they usually are in the cerebellum. So they're close to the brainstem. And in those patients, the cerebellum is involved in our ability to coordinate, balance, and so on and so forth. So the symptoms that you get from the cerebellum could involve movement-related symptoms. The cerebellum is also involved in the modulation of speech. So in severe situations, people can have mutism from significant, cerebral dysfunction. People can also have tremors. So location really plays a key role. And in Abby's situation, it was left temporal lobe, which was really where her language was, and even the memory areas, she doesn't have a hippocampus in that temporal lobe, which is supposed to be our memory retrieval area. We have it in both temporal lobes, but the hippocampus on the left side, where it's your dominant hemisphere for language, plays a significant role in memory and so on and so forth. But she's been able to compensate, with her right hippocampus, and also she's developed some ways to adapt, which is quite remarkable and admirable. I think what people should take out of this is, even though a brain cancer diagnosis is it's extremely devastating, I think that people should rest assured that most oncology centers are working very hard to be supportive of these patients, and will leverage all the technological advances that are available to ensure that people can overcome and deal with the cancer appropriately. Ultimately, as Abby's example illustrates, spirituality and staying healthy and just, believing in a bigger purpose, it's very, very important in actually sustaining people through this very challenging journey.
And I know that the ongoing research by, places like Moffitt and others, is constantly, advancing this as far as care and treatment goes. Abby, any final thoughts from you before we say goodbye, whether it's about your own personal journey, advice to those who may be watching us today? Any final thoughts before I let you go about your day?
I think, just like Dr. Etame said, it's just having the courage and knowing that everything is going to be fine, and just being as positive in the mind, and just reaching out to other people if you need anything. And it's all about your mind, body, soul. You've got it.
And that is the perfect way to end this, all about mind, body, and soul. Abby, thank you so much for sharing your story with us. You're truly inspirational, and I wish you nothing but the best. It was really a pleasure to get to talk to you. And Dr. Etame, thank you so much for taking time out of your busy schedule. It's things like this that make me so thankful to work for a place like Moffitt Cancer Center, when I can call someone like you, my colleague, who is way smarter than I will ever be. So thank you so much for taking the time out, both of you. And thank you to our Facebook viewers. And remember, if you want to get more information about Moffitt Cancer Center in general, or about our neuro-oncology department and awake craniotomies, you can visit moffitt.org online. Until next time, I'm Steve Blanchard. Thanks for tuning in, everybody.